Welcome to this group presentation on conjunctivitis by Group 315. Conjunctivitis is an inflammation or infection in the conjunctiva, which is a thin membrane that covers the inside of the eyelids. This is usually caused by fungi, virus, bacteria, exposure to chemicals, or an extenuating presence of a foreign body within the eye. Signs and symptoms for conjunctivitis include redness, sensitivity to light, itchiness, burning, swollen eyelids, discharge, and increased tears. In most cases of conjunctivitis, treatment is not required as symptoms cease over time, but treatment is available. In worst-case scenarios, conjunctivitis can cause permanent damage to the eyes. Bacterial conjunctivitis is often associated in cases of the condition being damaging. Bacterial conjunctivitis is a form of bacterial conjunctivitis that develops through the contraction of the sexually transmitted infection gonorrhea. The best possible outcome if conjunctivitis is left untreated is the infected area will naturally resolve itself. This is usually within a 2 or 1 week time frame. A wait-and-see type policy is regularly carried out to minimize the risk of generating side effects from any antibiotics. The direct cost of treatment of bacterial conjunctivitis can be split into 3 sections, which are the initial visit to the general practitioner, the cost of diagnostic tests, and the cost of prescription medication. One medicine found on the pharmaceutical benefit scheme called chloramphenicol, which are eye drops that can be used to treat bacterial conjunctivitis. Its general patient price is $20.66. However, this medication is a restricted benefit, with its patients identifying as Aboriginal or Torres Strait Islander only receive the medication subsidies. The least expensive evidence-based approach to treating the conjunctivitis are generally the most common. Recommendations such as good hygiene, avoiding contact with people, and hand washing reduce the risk of transmission. Methods such as rinsing the eyes with cold water and cold or hot compresses can be used to reduce the discomfort and irritation of the infected eye or eyes. In other and more severe cases, prescribed antibiotics and over-the-counter eye drops or artificial tears can be considered. As stated throughout this presentation, in most cases of conjunctivitis, no treatment will be needed since the body can recover on its own. However, if symptoms persist after 7 to 10 days, they should be referred to an ophthalmologist. This is generally after the patient has been seen to by their primary care physicians, such as a pharmacist, a general practitioner, or a nurse practitioner. That concludes this presentation on conjunctivitis by Group 315, and I hope you enjoy. Welcome to this group presentation on conjunctivitis by Group 315. Conjunctivitis is an inflammation or